A 63 years old man admitted with rest pain and foot ulceration. An angiogram shows 3 centimeter area of occlusion of the distal femoral artery with 3 vessel runoff. His ankle brachial pressure index is 0.4. What is the most appropriate course of action? So in this question, the key point: 63 years old man admitted rest pain and foot ulceration. That means rest pain and foot ulceration, it is the critical limb threatening ischemia. An angiogram shows only 3 centimeter area of occlusion of the distal superficial femoral artery and 3 vessel runoff. That means the distal 3 vessels, they are patent. Runoff means they are patent. His ankle brachial pressure index is 0.4. So it is the critical limb threatening ischemia. Critical limb threatening ischemia. What is the most likely appropriate course of action? Here the options are the conservative management with medical therapy and exercise, arterial bypass surgery with using PTFE, that means the polytetrafluoroethylene, arterial bypass surgery with using vein, primary amputation, and angioplasty. So what may be the answering option? That means, let's see, this is the superficial femoral artery and about 3 centimeter of the distal femoral artery, they are occluded. So what we can do for this patient? And here we can see the on procedure. Here we can see this is the balloon stent. Here this is the stenting or angioplasty. This balloon stent also known as the angioplasty. Here we can see this balloon or stent is expanded when this given in lesion area. So initially it was obstructed, but after that, after that the balloon or stent expanded and there is a canal created. So it is on option. The another option is there is the bypass. That means the proximal part and distal part, they are bypassed by the natural artery or vein or by the commercially available PTFE or dacron. PTFE, that means polytetrafluoroethylene or dacron, may be used. So here we can see the bypass procedure, and here the figure, and this figure is showing the aortoiliac. This is the abdominal aorta, lower part of the abdominal aorta. This is the common iliac. So in case of the aortoiliac obstruction, what can do? Usually the bypass, that means the aortobifemoral bypass may be done. Here we can see another option. This is the femoral with the distal femoral. So this bypass also may be done, but this bypass usually done in case of the long segment stenosis. Here we can see this is the long segment narrowing. There is the long segment narrowing. Also here this is the long segment narrowing. So in case of the long segment narrowing, there is the bypass, and bypass may be done by the artery or vein or the commercially available grafts like PTFE or dacron. So here we can see the PTFE and dacron. Here we can see this one is the dacron and the second one is the PTFE, and only the chemical composition is different, but the appearance is more or less same. So they can be used in case of the bypass surgery. So short segment disease is and good runoff with tissue loss is a compelling indication of the angioplasty. So when we can do angioplasty, we can do angioplasty when there is a short segment narrowing. So first of all, when there is a short segment narrowing, then second one, when there is a good runoff, and may or may not be tissue loss. So in this condition, we can use the angioplasty. So let's see what is runoff. Sometimes it is necessary. What is runoff? Runoff means there is a patent. Distal vessels are patent. So in case of distal vessel patent, we can use the graft or we can use the stent, and in case of graft, we can use the artery or vein, and we can also use the commercially available dacron or PTFE. Poor runoff, or in case of the blocked distal vessel, there is a high risk of the graft or stent failure. So what is our answer? As it is the very short, which is the 3 centimeter, so we can go for the angioplasty. And when it is the long type, that means the long segment, in this condition we can use the arterial bypass by using PTFE or using the vein or artery, and primary amputation only when there is a significant comorbidity or there is a significant limb loss.